Hello, viewers. Good morning, good afternoon, or good evening, depending on where you are joining us from. My name is Elias Gbadamosi, and I'm here today with two public health professionals, seasoned public health professionals for that matter. And today we'll be discussing public health in African movies as part of the Engage Africa Foundation's 2021 festival. So my first discussant today is Dr. Ebele Mogo. Dr. Ebele works at the intersection of research and its application in creating innovations and initiatives for a healthy future. Her training spans the field of community and behavioral health, health systems and policy, and biomedical science. She researches how African and Caribbean cities are changing and how this relates to non-communicable disease risks at the Global Diet and Activity Research Group of the University of Cambridge. She also serves as a technical partner for a wide range of public, private, and international organizations on designing systems spanning innovations to enable health-producing economies through her advisory practice at Erin Consulting. She leads Engage Africa Foundation, a Pan-African network focused on promoting the integration of health into development to reduce non-communicable diseases in African countries. And my second discussant is Ms. Ajoke Adebisi. Ms. Adebisi is a public health practitioner with experience in health and development on a multidisciplinary level. She has supported the development and implementation of programs and research that addressed HIV among adolescents, malaria in pregnancy, gender-based violence, child health, and non-communicable diseases. She currently works as a public health personnel with Nigeria's blood transfusion service. She also contributes to the global health of women and children and wants to improve Nigeria and Africa's health systems by addressing health inequities and contributing to the prevention and control of infectious diseases. Once again, we make welcome Dr. Ebele Mogo and Ms. Ajoke Adebisi. And this is just to inform you that we are social. The festival is online and we are online as well. So you can send us an email, engage with us on Twitter, Instagram, or Facebook using any of these social media handles and email address. And you can also follow the discussion online using these two hashtags. That's hashtag EAF Festival and hashtag A Promising Future 2021. And a little bit about the movie we are reviewing today. So for our discussion, which is centered on how public health is discussed in the scope of African movies, we are discussing this topic in the context of a movie titled Diamonds in the Sky. This movie was produced in 2018 by Nigerian movie actor and producer, Mr. Femi Adebayo, and also directed by arguably one of the best directors in Africa, that's Mr. Kunle Afolayan. So it's about three families and how they navigate the uncertainty and struggles that come with living with cancer. Now to our questions for this discussion. So my first question goes to Ajoke. What was your first impression when you saw this movie? Like, what was the first thing that came to your mind immediately you saw this movie?
Okay, thank you, Elias, for the question. Before I watched the movie, I already had an idea. I knew it was going to be about health, public health. So I had an idea before starting. So that already gave me a first impression before watching the movie. And then when I started watching the movie, I decided to, what's the message? was on my mind, okay, what message is this? I know it to be about health, but what exactly? She has a boyfriend. Are they going to talk about sexual reproductive health? But along the line, I began to put 1+1 together. I knew, okay, this is talking about cancer, awareness of cancer. That's towards the middle part and the end of the movie. So at the beginning, I was still guessing because that was when Teniola had a boyfriend. When he came to school to pick her up, I was thinking, okay, what are they talking about? Is it sexual reproductive health? But later I discovered that, okay, the movie is going to be about cancer awareness.
Thank you very much. And next we go to Ebele. So what was your general impression about the movie when you first saw it?
Awesome. Well, thank you for the very warm introduction, Elias.
The pleasure is mine.
So someone actually tweeted at us. We had I think we were doing some tweets around on EAF's Twitter. We were doing some tweets about media and public health. I think it's an article you had written actually. So somebody said, hey, you people should actually check out Diamonds in the Sky. So I think one evening I just thought, okay, what should I watch today? And I said, okay, let me watch this Diamonds in the Sky. So I knew that there was some health twist, but like Joke said, I was kind of like, where is it going to go? You know, I wasn't quite sure actually, you know, so it took me a while to finally piece it together. And I was like, oh, okay, this is what's happening in the movie. Yeah.
Great. And I think for me, the first thing that came to my mind when I saw the movie was like, this is a well-produced movie. Like the storyline is coherent. And besides that, the production quality is also top-notch, I would say. You know, like I like the production quality, I like the storyline. And so that like blew my mind. Like I wasn't expecting something that well made, especially because I've seen a lot of African movies where health issues are discussed, they are not discussed from a professional perspective. You know, it's just like a slapstick or something. Like there was one series that I saw recently, and you know, a teacher actually diagnosed one of our students for dyslexia, and I'm like, how can a teacher diagnose a student for dyslexia? You didn't see a doctor, you didn't see anyone, any health professional, and because the child had challenges comprehending in class, the next thing was, oh, he has dyslexia, and she went ahead to the parents and informed them that their kid has dyslexia. And I'm like, no, this is not how it should be done. You need to see a doctor before being certain that the child has dyslexia. Not every learning disability is dyslexia, you know. And so I didn't see that happening in Diamonds of the Sky. And I think it's the influence of, because I think the wife of the former governor of Kwara State, Dr. Omolewa Ahmed, she's actually the founder of Leah Center that was used in this movie as well. And she's a medical director. So I think our influence in the movie actually shows through, because the health aspect is discussed as it should be discussed. So that was the major thing that jumped out to me. Like, this is a well-produced movie. It discusses health as it should be discussed, not just jumping into conclusions or ascribing everything to spiritual matters. Yeah. And now to our next question, which I'll pose to Dr. Ebele. So what do you think about the basal connections between Teniola, who is a young undergraduate, Labake, who is like a provisions vendor? She's not wealthy, she doesn't have money, and Aisha, who is a wealthy managing director of a business conglomerate. What do you think the lesson or the connection is there? Like, the three of them has cancer. What are your thoughts about this? Why do you think the movie uses cancer to connect the three of them?
It's a very good question. I think that the movie was trying to take this same issue and kind of refract it through different socioeconomic or different like stages in society or places in society. So it's almost like this one thing, you know, all of them had some sort of And it was almost like, I think like Ajoke said, it's like, you're like, is it something sexual? You know, it was like the blood, it was the period, it was something. So
Mm-hmm.
in a way, it's something that I guess all people who are born female share, but at the same time, there are different positions in society make them experience it differently. So I
Sure.
thought that was really interesting. So now you have Teniola, who is a young girl, she's a student, she's kind of concerned, you know, I guess she has this boyfriend. So it's like, are they going to get married? Then you have this other woman who she's quite well to do, but she's kind of lonely. Like she'd lost her husband. Her experience
Yeah.
was quite lonely in dealing with this thing, and she's trying to protect her, I guess, her inheritance. And then there's the other Labake who is like she's sells in the market. She has this husband. She's quite close to him, and then she's dealing with her own. You know, she's not as literate in English and all of that. So it's like
Yeah.
it was very interesting to refract this thing through their different experiences. Yeah.
Thank you very much. And Ajoke, what do you think about that?
Okay, at the beginning, like they all experience symptoms of cancer, like whether they had or did not have cancer, they all experienced the symptom. Three of them experienced the symptom. So they did not confirm until they went to a healthcare facility that later directed them to refer them to a superior healthcare facility where they can either diagnose the cancer or so like it was like okay, they all experienced symptoms, but at the end they were able to confirm whether they had cancer. I think that was the similarity between all three of them. They all had symptoms, and at the end, they were able to properly diagnose their cancer status.
You know, because of my training in media and communications, whenever I see movies, I see it from that lens most of the time. So when I saw this movie, I'm like, okay, Labake, Aisha, and Teniola, they are three different
Yeah.
women from three different, socioeconomic status and different levels of literacy, like Ebele said. And so the thing is, the first thing that came to my mind was something in media effects that's called identification. Like the best way to persuade people, like to change their behavior, is to portray people in movies that look like them. So when someone who is a university undergraduate sees the movie and sees Teniola, she'll be like, oh, so this is a young viral university undergraduate. I'm a university undergraduate too. If she can have cancer, that means it's something that can happen to me as well. The same thing with Labake, like, and the same thing with Aisha, like, cancer is no respecter of anybody. Cancer doesn't respect your socioeconomic status, doesn't respect your level of education, doesn't respect your level of exposure. And I think that's just to make viewers identify with the movie and to like take it seriously, take the risk of
Yeah.
cancer seriously.
Okay.
And my
Yeah.
next point of discussion is one thing that I'm sure the three of us would have seen this in the movie because we all saw the movie. So when Labake first discovered a lump in her breast, so her husband was like, oh, this thing has to be boiled. The same thing when Teniola also first started experiencing the symptoms of what was later diagnosed to be cervical cancer. She and her friends concluded that it must be a menstrual period. And it's the same with Aisha, who thought the blood flow she was seeing was an unusual menstrual flow before the doctor confirmed it to be symptoms of cervical cancer. So what do you think this teach us about our approach to health issues as individuals?
Okay, like usually when we experience some strange signs or symptoms of any form of infection or disease, we usually would I say self-diagnose. We don't seek professional care before concluding. We just like, okay, like we don't take our health too seriously that immediately we see a sign or symptom of a disease, we seek medical opinion. Like we just go ahead, maybe you're coughing, you just go to the pharmacy close to you, get a cough syrup. Like we don't take things too seriously until it becomes okay, it's getting late, like until the infection or disease gets deep into our system before we now get scared and say, okay, let me go to the hospital or see a doctor. Like we just overlook some things about our health. It has happened to me. I don't know if it has happened to you. Like you just see a sign of something goes wrong and you're just okay, it could be this. Let me wait for 3 days to be sure if it's this or that. Like we don't seek medical care immediately. That's
Yeah,
what I can.
there's a probing question I would like to ask, but I would first like to go to Ebele, let Ebele answer the question, and then I'll ask my probing question.
Okay.
I think that people often, I agree with what Ajoke said in the sense that it's like, yeah, we kind of wait to the last minute, maybe because also we have too many things to do. I sometimes even do it. It's like you just have so many things going on, and you're like, okay, I'll get to this, I'll get to this. I noticed that there was also a whole lot of like fear and secrecy. And I think that gets in the way. So it's like, if you notice, they won't say, oh, let me call the doctor or something. They'll say, oh, the husband came. He was like, oh, that aboniki that I gave you, did you use it? So it was like, it was interesting. Like people go to what they know and like in that, like where they're comfortable, because especially because of the kind of issue that was being portrayed. It's like a very personal issue. I think it's also connected to the fact that like we don't have a lot of maybe information in a sense, like, and also we don't have systems that are set up for like preventive care. So I think a lot of what people do to deal with preventive care has to do with what they know. So what people tell them, someone that refers them, where they feel safe, what is convenient. So I think if we had more preventive care, maybe people would have more information that they could act on things in a timely manner as well.
And you already answered, because the next question I was going to ask was, okay, why do you think that happens? But you already did justice to that. So I'll go back to Ajoke now. So why do you think people self-diagnose?
Okay, let me use malaria as an example. Because you've had malaria before, you know the symptoms of malaria already. So when those symptoms come back, you just think, okay, is it not malaria? It's the same medication my doctor prescribed the last time. So sometimes we have ideas of what is already wrong with us, or maybe a family member already knows about, okay, maybe it's typhoid because you are throwing up, it should be typhoid. So they don't bother going to the hospital again. They just go to the pharmacy. And for example, in Nigeria, the pharmacist will not ask you for a prescription before buying medication. You can just go to the counter, go to a pharmacy and just get medication, and they'll give you. You will use it and you get okay. But sometimes our diagnosis might be wrong. We might use the medication we are not supposed to use. So I think there should be awareness on these things. Like, don't self-diagnose, seek medical opinion. Even if you've had it before, you know what the doctor prescribed, you are seeing similar symptoms. That should not be like an opportunity for you to just self-diagnose yourself.
Thank you very much. And when I saw that as well, the first thing that came to my mind was like, is it something that has to do with their socioeconomic status? Because when Labake saw the boy, you saw the lump, she was like, oh, it has to be boiled. And the next thing I was thinking was, okay, could this be connected to the fact that people self-diagnose because they can't afford the prohibitive cost of healthcare in Africa? But when Aisha also started seeing this unusual blood flow, the next thing she also did was she went to the pharmacy, bought some sanitary pads, and I'm like, oh, then it has to be something bigger than this. Like, because Aisha has all the money, she could have just gone to the hospital to seek expert opinion, So that was when it clicked for me. Like, then it has to be something much more than money. Like, and both of you have done justice to the question, to the reasons why people might self-diagnose, which include the fact that the symptoms might look like symptoms of the things they've experienced in the past, or it might be because preventive care is not as strong in this part of the world, in our part of the world. And now I'd like us to digress a bit and talk about the African values that we see portrayed in the movie. So do you think that our values as Africans, the cultural African values, are consistent with global health practices, like the best practices of health globally? Dr. Ebele.
I think it's always the question of what values, because I think that global health belongs to all of us. So
Yes.
definitely our cultures also reflect global health, but there will always be those things that enable global health a bit more, or health, and there are those things that that don't help improve our health that we'll have to curtail. And the question is, how can we amplify those things that are beneficial for our health while transforming those things that are not beneficial for our health? And sometimes I think that how can we also integrate what is known so that it's more accessible in the way that we can access it in our culture, right? So when I think of certain African values like storytelling, for example, everybody was like, oh, yes, it was kind of not used in the best way in this movie, but it was like, talk to this person. I heard from this person, whatnot. Like, how do we bring, I always like to think, how do we bring it home to and embed it in our culture? So there are aspects of the culture, or even like the social aspects, like we're very much community oriented. So a lot of these people had people around them trying to help them. But there were also some negative things like the stigma, like, they was just so afraid. Like this lady that you said that had access to the best healthcare, but she covered herself the most, like she wore glasses to go to the hospital. So that there was that. There was also a bit of the, I guess we like to say, a bit of that patriarchal element where like almost if you notice with Labake and her husband trying to navigate to have access to care. And then like with Teniola where there was this whole issue of if this boy is going to marry her, if she can have a child.
Yeah.
So it's almost like, how do we make these things we want to say about in health, integrate it into the values, and then maybe amplify those aspects of our values that actually serve global health?
Nice. Miss Adebisi.
Okay, just like what Ebele said, she was talking about social aspects of health and how, like in the African context, we are community oriented and we always like. I want to like add to it, like for example, in sexual reproductive health, usually you discover that girls, or let's say teenagers, they will usually seek opinion of their peers or an auntie in the community. Aunties are known to be closer to teenage girls, like even compared to their mom, they can confide in an auntie. So for if we can bring this to health, why don't we create awareness amongst these aunties in the communities, like awareness, train them so that when these girls come to them, they give the correct information. Like let's look at what is applicable in our cultural customs, our cultures. Let's look at the things that work so that we'll now, like training of healthcare workers, like aunties, for example, you can train them. And if it's when it comes to cancer, let's bring it in, like let's look at what is applicable in our cultural context, how it can affect awareness. We can create awareness among community leaders, among community healthcare workers, so that they'll bring this health information home. Let's bring it home. Let's not make it out of the box. Let's bring it home. Like include these community people as healthcare providers, include them as people that can disseminate health information, like something like that.
Nice. And I agree with both of you. Totally. Like community is a huge part of our culture as Africans. And I think the more we can mine that to extract the benefits of community, to disseminate health information, the better it will be for us. And also, when Dr. Soji, who happens to be Kayode's uncle, diagnosed Teniola for cancer, his reaction was, I don't want to say terrible, but I was disappointed because I'm like, this man is supposed to be a medical doctor. He's supposed to know a lot more about cervical cancer. And his reaction was like, oh, Coyote, this girl has cervical cancer. She has to undergo a procedure where her womb will be removed, which means you can't marry her. It has become, you both have become forbidden fruit to each other. You can't marry each other. So my question is, and then I tried to bring this home, like, what if I was in Dr. Soji's shoe? What would I have done? And that made me think about some of the tensions that we sometimes feel when it comes to our professional ethics and personal values or family commitments and professional ethics. So how do you think we can navigate this kind of very, very tough and dicey situations? Like when we have a family commitment on one hand and our professional ethics is also tugging at us on the other hand, So how do you think we can strike a balance?
Okay, it's just like being a counselor for HIV/AIDS. Like that's what I do now at Nigeria's Blood Transfusion Service.
Okay.
Now a donor's status, HIV status, and then because you're familiar with them, or maybe your friend is dating him, and you want to help your friend out, like by telling her, do you know he's HIV positive? That's it's so unethical. You should be confidential. I would have expected Dr. Soji to be more confidential and professional in his job. Like he shouldn't go to tell the family of what was Teniola's boyfriend's name? I cannot remember now in the movie.
His name is Coyote.
Kayode. He shouldn't go to Kayode's family and go and tell them. He should have even spoken with Kayode first about it. Like, even if Kayode brought his girlfriend to the hospital, he should have talked to Kayode, not going to his parents to go and tell them Teniola had cancer and she's dating Kayode. That was so unprofessional and unethical. I don't know if his license can be seized because of that, but I think they should have been more there should have been more confidentiality. It should have portrayed as it should have worked as a professional, like in that area. He did not try at all. Like he shouldn't have
But do you think it will be
handled
easy
it.
for him to like keep that to himself, knowing full well that Coyote is his nephew, and like he might end up not having any child in this world? And
But I think he rushed though. Like, I mean, he didn't even he came to conclude. In fact, that guy really bothered me. But then I was like, okay, this guy is acting well because I'm totally forgetting that I'm watching a movie right now. Because like I think he hadn't even done the right test because eventually it was what he sees the diagnosis was proved wrong. And then secondly, he I think it was one thing to tell someone that sorry, I'm a bit maybe we can mute okay. All right. So I was saying that I think he rushed to the conclusion. And I think there's a reason why people don't seek help for some of these issues because of the lack of trust. Like people don't trust. If you have some people have insurance, like if you have insurance in your workplace in Nigeria, you're still going to be afraid that the nurse might go and tell your colleagues that something is wrong with you. So it's very hard, even when people have so-called access. I think that I think he colored it with his values or his experience. You remember when he was like, you know what, I've been divorced, so cut it off now, or something like that. Like that, I think that had nothing to do. I think there's a place for saying, you know what, okay, these are the challenges that you're going to face, but these are the options available to you, and you can make your decision. And if for whatever reason, he still even had to tell him not to marry her. I don't even think that's professional. I think going to tell his family like just a week after, that was just too much. It was just, I think, man. Yeah, I agree that they need to take out his license, even though it's just an actor. So that's what I think. And I think that like this is a position of power that healthcare professionals are in. So it comes with these ethical issues and you have to handle it with so much care. That's part of the experience of providing care. Yeah.
So much confidentiality.
Mm.
And after saying that, I'm like, okay, maybe I should never seek medical advice from family members anymore. Like, if I want to seek any medical advice now, I'll go far away from home, like to someone who doesn't know me, who doesn't know my family or anything.
You see, and that's the thing. Even therapy or things like that, like they portrayed it well in the movie because, like, I've seen people say, like, I talked to a therapist. Next thing, this therapist told my family everything that was happening. So how can we expect people then to go and
go and meet therapy? Yeah.
And like Joker was saying the other time, when you work at an HIV/AIDS diagnosis center and someone walks in who happens to be your friend's boyfriend and he has HIV, what do you do? So these are very, very tough value situations. But like, I'm sure we'll always find ways to navigate these things. So from the movie, I would like to ask the question, how important do you think the media, especially when it comes to movies and music, how important would you say these channels are for health advocacy or health promotion?
I would argue, I don't even think, I'm thinking of certain health issues just growing up. I think I heard more about health issues from the media than necessarily public health professionals, Like growing up, they had, I remember they had like, there was one like Zip Up, I think it was about like sexual health.
Yeah, I remember that too.
Yeah, and then you have like the movies, what they portray, how they portray like AIDS. There was one movie that I think it was called Tomorrow Never Comes or something like that. And I think, was it Hilda Duke, but somebody had AIDS and the person died. Like that was the first time that I really heard about AIDS. And so like, I think the media plays a huge role. Like it just can't be underestimated. Even now, like from a research perspective, like when I'm working on a project looking at who is actually sharing information about some behavioral health, like physical activity or things like that. We're finding that at least in countries like Nigeria, Cameroon, it's actually social media influencers that are sharing more information online. So it's more likely that you've come across information from someone in the media before you hear from a public health professional. And like it may not always be evidence-based or anything, but those are the people that people might hear from first.
Okay, the media is a very good channel to pass on health information. Very good and important channel, because a lot of people look up to the media, like for fashion, for lifestyle, so many things. People look up to the media. Like the media portrays a lot to us on our culture. It brings people together, and using the media as an awareness strategy is good, because like diamonds in the sky, you can't even like the reach, it would have reached thousands of people. The message would have reached thousands of people. Very important strategy. And there's a lot of wealth of information that can be passed from the media to the population, because like, for example, diamond in the sky advocacy, that was a good strategy. Like if you look at the number of people that would have watched that movie by now, you'll be surprised at how the information has gone so far. So I think it's a good strategy. It's not just about telling people one-on-one, okay, this is cervical cancer, many people might not get the information if you do one-on-one or personal counseling, but the media is looking at the masses. So I think that's a good avenue.
Nice. And I also feel the same way, like to draw from what Dr. Ebele said, before most of the information I see about health, I see a lot of information about health from the media than even from public health professionals or advocacy groups, which means that the media and entertainment sectors can be very pivotal channels to talk about or disseminate information about healthcare and public health generally. And that reminds me of this particular song, when the coronavirus pandemic was still at its peak last year. There's this Nigerian musician, Fuji musician, his name is Pasuma. So he released this track called Coronavirus. That's the title of the song itself. And in it, he was singing. The music is danceable, very danceable. And there's still a lot of information about coronavirus there. Like, he was telling people to maintain 6 feet from each other, to respect the stay-at-home order, to make sure to wash their hands, use their hand sanitizers, to not touch their faces with their bare hands, to use their face masks and things like that. And I'm like, there'll be thousands and thousands of people, or even maybe millions of people, who have listened to this song. And by virtue of the fact that even Pasuma sang it, they'll be like, oh, I'm Pasuma's fan. And since Pasuma sang this song, then I'll do as he said. And also, talking about identification the other time, which is also a media concept, like when people see things happen to people that are like them, I'm a student, I'm young, I see someone like Teniola having cancer in diamonds in the sky. The message I'm getting is like, oh, I can connect with Teniola because I'm a student too. I'm young as well, which means I'm also at the risk of cancer. And because I see that projected directly to me, it might give me the push to take action, maybe to get screened for cancer and all of that. And there's another very interesting thing about this movie. I like the way they dabble into a lot of things like religion, social norms, and culture to discuss, to portray health issues. And there's one major character, a clownish character in the movie, Professor Salamander, who is the magician. Who is the magician? He was like, oh, what your wife has is a terrible disease. It's a disease that can kill. It's the devil that puts this mark on people. She will have to spend, is it 7 days or 3 days with me? I'll have to bath her for 7 days. She will be here with me and all of that. So what do you think characters like this represent in the movie, like Professor Salamander? Let's start with Ajoke.
Okay, there are so many unprofessional doctors. They call themselves healthcare professionals or healthcare. I don't want to say herbalists. We have so many of them. They'll tell you, use this herb, use this herb. Like, there was a case of diabetes in my office. Like, I lost a colleague to diabetes.
Oh.
And before she died, you see her going after some plants. Okay, she wants to plug this plant. It helps to help her with the diabetes. Like, she was just going to different, like, we have so many of these. Okay, let me advise you, use moringa or use this leaf for your blood pressure, use this leaf. Like, yeah, we have so many of them in our societies, and some people depend on this herbal medication from non-professionals. They believe, okay, they have the treatment for it. It's not just the foreign medical care. Like, the hospitals now, they will regard them as, okay, foreign, but these other herbalist or healthcare providers are not professional. They are local. They believe, okay, they know the truth. They know what to do. We have so many people who come to sell things to you. Okay, use this it's just 2,000 naira. Use it for diabetes. Use this it cures cancer. Use this. But we find out that people believe them. How do we stop this? Can we train? Because I've heard of instances where community health workers were trained on these things. because you don't know you're taking a medication that has no prescription. You don't know if you should take it more than once a day. You don't know if you should take it, but you were told by a herbalist, do this, take this 3 times a day. It's very risky. So I think there should be awareness around this. People should go to seek professional medical care. Seek professional medical care. It's not just the white people that influence these medicines. Seek professional medical care, because sometimes without this awareness, there are a lot of Africans that depend on traditional methods of healing. So I don't know how we can stop this, because it's a lot of work. It's a lot of work. A lot of people don't seek professional medical advice. They just depend on their community.
So, Ebele, what are your thoughts about it?
Yeah, that guy was such a funny guy. Even the name Professor Salamander, it was just hilarious. Honestly, I found what was interesting was that even after, what was her name? Labake, right?
Labake, yes.
After she went to the doctor, she still went back to this guy. You know, I think there's one element also, like we're also very like religious or spiritual culture. And if someone tells you that kind of thing, I think like it sort of bears heavy on you, you know.
Yes.
So if someone tells you that versus a medical professional, I think a lot of people will still like weigh this kind of spiritual cultural aspect of it. So I think that's one thing. Another thing that comes to mind is what Ajoke said around like you know, people relying on a lot of like traditional, because a lot of people seek informal forms of care much more than those who do. And considering the fact that in Nigeria, for example, in Nigeria, there's a huge doctor shortage. A lot of people that can see doctors are those that can afford it. So I think there's a big gap, and we can't. Again, it's not bad or good. I think it's like this. For example, this indigenous forms of care and whatnot. How can we can learn from other countries? Like this is like China. You know, they're not necessarily throwing everything away, but they're investing in their own sort of indigenous medicine to understand, okay, which one is evidence-based? How can we integrate it? I think that's a huge issue that we need to consider, because we can't even afford to, most countries can't afford to provide care for everybody. And so how can we build a bridge with maybe more community-oriented forms of care that maybe a bit more affordable, but then make sure that there's some sort of standards and norms around this? I think that we have a big gap, maybe also a big opportunity around that.
Yeah. So looking at it as well, it's a big gap and a big opportunity as well if we work actively to leverage it. And you know, like you were saying, it's also because we are a very spiritual society, and I see that it's the same thing not only with Nigeria but with other African and even Asian countries that are also highly spiritual. You know, I was taking this health communications class, and my professor in that class is from India. And in our discussion about mental health care across cultures, and I realized that we bonded over, you know, discussing spirituality in our cultures as regards mental health care. And I realized that from our discussion, it's the same thing. You know, the fact that India is a very spiritual community, that Nigeria is a very spiritual community, all of these things weigh a lot in how we approach medical issues as well. So most times we seek spiritual care for medical problems, you know, the same, even while we are still going to the hospital, you know, because we think village people that the village people factor is also a part of it. So as we get spiritual care, as we get medical care, we get spiritual care as well. And like you said, Ebele, it's also in the way Labake approached our cancer. You know, she went to the hospital and she also went to see Professor Salamander, who happens to be a very dubious fellow. Yeah. And you mentioned something when you were talking now, Ebele, about how the costs and the cost of healthcare, number one, and the scarcity of healthcare professionals in Nigeria kind of pushes people sometimes to seek unconventional advice, to seek medical advice from unconventional channels. So how do you think we can manage this? There's an urgent need for the government to pay more attention to the cost of healthcare and the shortage of medical health practitioners. How do you think we can approach this?
Mm. I think that it echoes some of what we said around bringing health home, your healthcare home. The truth is that a lot of our clinical care is very much based on our history of colonization as well. So a lot of this was created sometimes just to protect sometimes to protect the white people that were coming. Very disconnected. I think it also creates those trust gaps. It's like there's the formal care, there's the other care. And I think that maybe the opportunity is how we can integrate this into the system. For example, there are places where Ghana has this community health worker thing where instead of investing just on hospitals, in fact, a lot of care is not about hospitals. Prevention is not about hospitals. So having what Ajoke said around having community health workers that are trained, that are part of the community, that understand a lot of things as the first point of care, people that go to people's house, people that are from your community, it reduces the cost of care very, very much. And at the same time, it's much more effective. So how do we take this people? I read of a program in I've forgotten where, but it's called Mama Ekaya. I think it's in South Africa, where they work with I think it's like older women that are in this position of power. People trust them, they're the matriarchs of society, and they actually train them in providing some sort of therapeutic care, mental health care. And this program had better results than people that were relying on the clinical care.
Wow.
So it's like, how do we make this bridge between both? I think that's the opportunity. I think it can reduce cost and it can also build trust. But it is this whole dichotomy between sort of the Western and then this informal, and most people can't even enter this other space because of language, cost, and whatever. So I think that's the opportunity that we have, anyways. Yeah.
Thank you very much. Joke, do you share the same
And
sentiment?
just to add to what, yes, absolutely. Just to add to what Ebele said, if you look at it, there are so many programs now to train traditional birth attendants. Because let's not deceive ourselves, people seek healthcare from these traditional birth attendants. So training them will go a long way in preventing maternal deaths. We should not just ignore the fact that people seek healthcare from these people. People seek healthcare from traditionalists, from birth attendants, the traditional doctors. Let's embrace them as part of the family of medical care and train them, provide awareness to them, look at their processes of healing. Let's educate them, let's train them so that even when they are providing these healthcare services, they provide healthcare services that are genuine, that will not bring about harm to the patient. Let's train them, let's create awareness amongst them. Let's include them in our, will I say in quotes, healthcare providers. Yeah.
Thank you very much for these wonderful insights.
I wanted to
Ability. Okay.
Oh, go ahead.
Go
I
ahead.
wanted to say let's also learn from them, because there's some things that work in our culture that do work, that are protective for health. And I think that we haven't really built on these things because, again, that dichotomy, sometimes people also, it's very hard because on the one hand, you don't want people to use bad advice in the name of our culture. But on the other hand, there are also aspects of our culture that we have not really leveraged. There's some things around maternal health practices that people did in the past that actually work. So how can we also learn from these things and then integrate it into how we practice public health?
So do you have any ready example of these kinds of maternal health practices that we already practice in Africa that might be of help?
Well, I think one popular one that people talk about a lot is Igbo, so Omugo, where the mother actually comes when someone has a child, you take care of the person, you take care of the child. A lot of women, might be depressed or have postpartum depression, right, when they have a child. So having that, well, there may be some, it's not like anything is perfect, but like if that already exists, is there a way that we can build on that? There's some practices that people had around when, like, especially in communities that had lots of waterborne diseases, you find that, I can't remember what they did, but it's almost like, how building the child's immunity anyway. So one of the practices in sort of when kids are born was to, I don't want to get this information wrong, but I think it was to like give them like water, whether it was water from the river or something, but in a way it built their immunity. So then people were wondering like, how come people are living in this area with lots of like waterborne diseases, but then it's not a lot of infants are not dying as much from it. So that's the thing. I think that like there are also things that we do, or loneliness. Do you know that loneliness actually they said that loneliness is almost as bad as like smoking in terms of your life expectancy. And we're so community oriented people. I mean, it's not like it's perfect, there are ups and downs with these different practices, but I think the more that we also research these things and learn them and then see how can we build this bridge. So I think it will be a two-way thing. Well, I think it's a conversation that we're not yet having enough,
Okay, so it's up to you both researchers, Ms. Ajoke Adebisi and Dr. Ebele Mogo, as public health researchers, seasoned public health researchers for that matter, to take up these gauntlets and research how we can leverage African cultural values and practices to improve healthcare outcomes. So this is a challenge that we are putting out to you. And for our viewers, there's something, my discussants today also share one thing in common. I was going through their LinkedIn profiles and I realized that they both attended the University of Edinburgh for their master's degree programs. So, and my next question is, we see the kind of existential distress that these three women who are struggling with cancer go through. Like, they are so distressed, they are depressed, they are afraid, of the things of how their lives might change because they have to deal with cancer. So how do you think we can show empathy and care to people who are living with healthcare diseases, like with diseases like cancer, like mental health, illness, and some other terminal or non-terminal serious diseases like that?
Okay, I think creation of support groups is very important. I think we have a couple of them already in place now. I know there's this support group I heard about for cancer patients by a young person. It was established by a young person. I can't remember the name now. If we can have more of that, support groups for cancer patients and also for their families. Like if we look at the way HIV in Africa, for example, there are support groups not just for the HIV patients, but also for the families of those affected by HIV. So support groups are important. Let's create more of that and also create awareness on why there should not be any form of stigma against people with cancer. Let's support these people, even in as like using family as an institution. We can create awareness amongst ourselves, amongst families, on how to support people living with cancer or any other non-communicable disease. Is very important. Like the loneliness alone can make you have more problems as a cancer patient. So if there are support groups in ground or on ground, it will go a long way. And let's encourage the cancer patients from the hospitals. We can connect them with these support groups. Like, I don't know if that will be possible, but I think that will go a long way.
Thank you very much. Ebele, your thoughts, please.
Yeah, I think that, like you said, it's, health issues are not just about the clinical aspect, it's very much about the existential aspect and what it means for people and the socioeconomic aspect. And I think, like, the more that we can bridge there, I was thinking of when the people did go to that Leah Medical Center and that girl might have had cervical cancer, but they were not yet sure. And the doctor provided information, I think, in a way that calmed her down, but also empowered her. He's like, okay, this is actually what is happening. This is where it might be. Let's look at this. It was a sense in which giving people, as human beings, like people, giving people that dignity in care and letting them feel empowered with the information they receive and letting them know what their options are. The truth is that even if someone is dying, they still have options. And I think that the best care helps to give that patient that option. Because when I read some of the stuff around, like, I don't know, some of the care that people provide for people that are terminally ill as well, it's like, it's very important for that person to know that, okay, even if I have a few months left, let them have the information and the power to make the most of that situation, even if they're dying. Like, how do they want to die? What do they want to do? Do they want to be around? So the way that care is provided is very important, and I think no matter how bad the diagnosis is, the way that it's provided can help the person navigate it in a much more empowered way.
Thank you very much. So one thing that stands out for me from your response is making sure that we empower the patients to be able to make certain decisions on their own, and to also empower them and, like, this is within your control, giving them that confidence, giving them their confidence back. And from Ajoke's response, one thing that stood out for me was sometimes we focus so much on the patients, and we also have to focus on their family members as well. Because, if this person is dying in a matter of months, dealing with that kind of loss can also be very, very tough for family members. So while we are providing support for people who are living through these diseases, we should also provide support for their family members who might also be experiencing some kind of, very, very tough, trying times at that moment. And finally, to my last question. So, Ajoke, if you have a budget of $500,000 now, and you're told to produce a movie around public health, what would the movie look like? What are the kind of health issues you will advocate via this movie? Okay. Or how will you spend the money?
Okay, I'll use Diamond in the Sky. Can you hear me?
Yes, very well.
Okay, like I really love Diamond in the Sky. I'll just use that as my I don't know, I'll use that as a sample. So I might not focus exclusively on cancer. I can focus on other issues affecting people, affecting populations. Like, why are women not going for their pap smear screening? What is stopping adolescents from getting the HPV vaccine? What is making adolescents engage in sexual practices without protection? Like, there are so many issues on my mind that affect public health, and I would like to solve, and I would like to be I don't have just one particular area to focus on. Maybe I'll make multiple movies with money just to focus on a lot of public health issues that concern me. Like, yeah, so I think for Diamonds in the Sky, they use Joker Silva. That's a very big, like, big budget to bring in Joker Silva. She's a very important person in the movie industry. So having someone like that in the movie will even go a long way to even affect the message, because people already see her as a role model.
Yeah.
It will even make the message more powerful and also more acceptable to people, because she's like a public figure, very important one. Like, if we can have more of that in our movie productions, it will go down well. Like, let's make good movies that will bring information to people, not movies with purpose. Like, let us attach purpose with our movies, more of it. Like, I would really encourage that. And if I have money to produce a movie like that, I think that would be very good.
So with this your grand plan, I think we'll have to up the $500,000, because you're already talking about multiple movies.
Yes.
Thank you very much. And Ebele, so what would you do with $500 to produce a movie?
$500.
$500,000. Sorry.
I will support Ajoke's plan. I think Ajoke's plan is very good. So
Okay, so you give her your own 500,000, so making it $1 million.
we'll just come together and we'll just
Wow.
conquer the whole African movie industry. That's what we'll do.
Great. Go big or go home.
Yeah. But I think we started in our little way with this festival. Really, I think this conversation is even a big start.
It's a very, very important, move, like to get the conversation started. And I think sometimes it is the domino that also set other things in motion. Like when we start discussing it, when we start talking about it on different platforms, and we bring people from, different sectors of healthcare, talking about health communication, public health. When we bring people together on this kind of scale, then we can discuss things more holistically and see things from various perspectives. There are so many things that you've shared here today that are like things that I've not heard about before, and I've been schooled to an extent. And thank you very much again for joining this discussion. It's been great having you here, Dr. Ebele and Miss Ajoke Adebisi.
Thank you so much, Elias.
Thank you.
I had a wonderful time, and it's been an honor, actually.
Yeah.
So thank you so much, and for all you do, like all your expertise. I think, the future is bright.
Very bright, I think.
Thank you, Elias. Thank you, Dr.
The pleasure
Ebele.
is mine. Yeah. So, Dr. Ebele, any final thoughts before we go?
Well, I think that anyone watching this, I think this recording, I'm hopeful that everyone, all the producers, all the different people in society will have a chance to watch this. I think the more we just whatever position one is, whether they're an actor, whether they're a producer, whether they're an influencer, or they share on social media, or they're caring for someone who has a chronic disease, I think if we can just reflect on some of the things that we said and see how that can impact us in the way that we care for other people, we communicate health information, then it will trigger that domino effect, and maybe one day we'll have a society that's very conducive and caring for people that are going through issues like this.
Nice. Thank you very much. Joke, any last thoughts?
Thank you. Okay, I think this was so refreshing and so many thoughts on how the media can impact lives of people, and also on how we can support those living with those living with non-communicable infections, how we could support them, and how we could create more awareness using different platforms like the media. I think this was very enlightening, and we hope to see more movies like Diamond in the Sky, and we hope there's more solutions and awareness around the issues affecting our health as a population.
True. I hope to see more movies like Diamond in the Sky as well, on our shelves and on Netflix, movies that portray healthcare, public health issues in the correct lights, well informed and well produced. And to our viewers, don't forget you can still follow this discussion online using the hashtag EAF Festival and hashtag A Promising Future 2021. Thank you very much, and enjoy the rest of your days.
Awesome.
Yeah. Bye.
Thank you.
Bye-bye.